The mission of BioStim is to be the global leader in PEMF therapies by providing superior products and services to patients on behalf of prescribing physicians. Therefore, the initial and ongoing communication between OrthoFix personnel and the patient is extremely important as we redefine the recovery experience through patient education. Once a doctor prescribes an OrthoFix bone growth therapy device, the patient will be contacted by an OrthoFix field representative.
Mr. Hammer, this is Marty. I'm calling on behalf of OrthoFix and Dr. Jones, who has prescribed for you a bone growth therapy device which OrthoFix supplies.
During this call, the field representative will confirm the patient's primary and secondary insurance and, if applicable, their post-operative treatment plan, such as going to a skilled nursing facility or rehabilitation. The field representative will also inform the patient that OrthoFix is in the process of seeking pre-approval and authorization from their insurance companies and encourage the patient to call their insurance company with any questions about coverage. And finally, the field representative should recommend that the patient visit our website, bonegrowththerapy.com, to learn more about the device that their doctor prescribed. In addition to the field representative contacting the patient, OrthoFix will send approved educational material to the patient regarding the bone growth therapy device. This information will be sent directly from the OrthoFix corporate office. Once the insurance verification process is complete and the OrthoFix insurance administrator has given the OK to fit, the field representative will call the patient to schedule an appointment. If the patient financial responsibility is known, the field representative may provide the estimated dollar amount the patient is responsible for, based on their insurance plan. In the event that the patient expresses an inability to cover personal responsibility, they should contact OrthoFix and speak to a patient care billing specialist at 800-535-4492. During this telephone call with the patient, it is a good idea for the field representative to briefly introduce the Stim on Track app and recommend that the patient go to their app store and download this free app either on a tablet or phone prior to the fitting appointment. If the patient does not download the Stim on Track app prior to the scheduled appointment, this can be done at the fitting appointment. On the day of the scheduled appointment, the rep will arrive promptly at the scheduled time.
Hi, I'm Marty with OrthoFix. I'm here to instruct you on the use of the bone growth therapy device that Dr. Jones prescribed.
Before beginning, it is important for the representative to confirm whether or not the patient has a pacemaker or defibrillator because PEMF bone growth therapy devices have a contraindication or warning about these cardiac devices. If present, the fitting should not take place unless the patient has consulted with his or her cardiologist. Once this is done, the representative will explain that the bone growth therapy device the patient's doctor prescribed has been clinically studied and FDA approved to improve success rates after spinal fusion surgery for the spinal stem and cervical stem devices, and to increase the chance for healing non-union fractures for the PhysioStim device. The representative will then explain that the device sends a signal called a PEMF, pulsed electromagnetic field, that stimulates the body's natural bone healing process by increasing bone formation and mineralization at the fracture or fusion site. The representative will explain the device wear time. In the case of the spinal stem device, 2 hours per day and 4 hours per day for the cervical stem device. For the PhysioStim device, the recommended wear time is 3 hours per day. The representative should instruct the patient to wear the device for the fully prescribed amount of time every day to improve the chance of favorable results. The devices provide daily treatments for up to 365 days, and patients should wear it until their doctor recommends that use be discontinued. The doctor will decide on the overall length of treatment based on a patient's healing progress. The representative will demonstrate the device's ease of use by showing the patient how to start and stop a treatment by pressing and holding the on-off button until it beeps. Once the device is turned on, show the patient how the OrthoFix logo appears on the LCD, followed by a status screen which displays the number of days the device has been worn, the number of days since the first use, and the compliance percentage, which we will explain in a minute. The LCD will show the treatment time remaining in hours and minutes, and a flashing on-off button will let the patient know that the device is treating them. The representative should inform the patient that the device has an internal clock that keeps track of the number of days the device has been in operation and the number of days a patient has completed a treatment. This is the compliance percentage that appears when the device is turned on. In order for the internal clock to function, the device must be worn for a minimum of 60 minutes one time. Thereafter, any treatment length greater than 1 minute will be recognized. In order to be included in the compliance calculation, the device must be worn for the full daily prescribed treatment time. The device runs on lithium-ion battery. The LCD displays the battery capacity, and the device will beep when the battery is low. The device comes with a one-piece charger. However, the device will not charge while in use, so the representative should advise patients to charge the unit every day after use. The field representative should point out the pages in the patient manual that explain and show how to charge the device. It is important to recognize that the cable fits into the port only one way. At this point, the representative should demonstrate how the device should be worn, then ask the patient to wear it. For spinal stim treatment of the lumbar spine, the device is placed as shown, with the coils centered around the fusion site. The coils and straps can be adjusted for proper fit and comfort. The cervical stim device is worn as shown, with the coils resting comfortably on the shoulders. The device does not need to fit tight against the back of the neck. Both spinal stim and cervical stim can be worn over clothing or bracing if the patient's physician has prescribed a brace. For PhysioStim, the device's coils should be circumferentially strapped around the fracture, and, just like the spinal stim and cervical stim, PhysioStim can be worn over bracing, clothing, internal and external fixation, as the PEMF signal is designed to transmit through these items. Patient can wear the devices while sitting, standing, walking, or sleeping. Once the device is properly positioned and adjusted on the patient, the representative should assist the patient with connecting the bone growth therapy device to the Stim OnTrack app. If the patient has not yet downloaded the app onto their mobile device, this should be done now. Once the app is installed on the patient's mobile device, the next step is to connect the Stim OnTrack app to the patient's bone growth therapy device. The bone growth therapy device must be on and providing treatment, and the mobile device, phone or tablet, must have Bluetooth on. Once connected, the appearance of the treatment screen on the phone or tablet is the indication that the bone growth therapy device has paired with the Stim OnTrack app successfully. Again, in order for the Stim OnTrack app to connect to the patient's bone growth therapy device, the device must be on and providing a treatment, and Bluetooth on the mobile device must be enabled. The representative should explain the benefits of the app, such as the daily treatment reminders and the detailed calendar tab that shows the duration of time the patient has worn the device, beginning with the initial treatment day. The representative will ensure that the patient becomes familiar with the Stim OnTrack app, including the treatment, calendar, and resources tab. The representative should point out the website links to helpful information for patients. Also, representatives may add their contact information to this screen if desired. The settings are accessible through any screen on the app, and this is where the field representative can assist the patient with setting up a daily treatment reminder for a time that is convenient for them. The OrthoFix representative will review the information located in the device box. This includes the instruction manual, the patient guide to insurance coverage, the STIM on-track mobile app manual, the AOB, the limited guarantee, the quick start card, and the ABN if applicable. The representative will have the patient sign the Assignment of Benefits form, commonly referred to as the AOB. The patient's signature on this form provides their insurance company with proof that they have received the bone growth therapy device and allows OrthoFix to bill the insurance company. The representative should remind the patient that they are responsible for any amounts not covered by the patient's insurance. The AOB contains important information, so the patient should read it. Patients may contact their insurance provider regarding co-insurance amounts.
As we discussed on the phone, it appears that you have a co-insurance. Now, should you have any questions regarding financial responsibility, please contact your insurance provider.
If the patient is a Medicare patient, it should be added that Medicare requires that suppliers of durable medical equipment, DME, charge a copayment, which generally is 20%, but may vary if they have secondary insurance. Believes the order falls outside of Medicare coverage guidelines, the field representative will provide the patient with an advance beneficiary notice of non-coverage for Medicare beneficiaries, commonly referred to as the ABN. As mentioned previously, should a patient have questions about payment, they may contact OrthoFix patient care billing specialists, commonly referred to as PCBS, who will assist them if they are concerned about paying for their device. The OrthoFix field representative may also call for the patient if requested to do so. In the unusual event that the patient or OrthoFix field representative cannot reach PCBS, the bone growth therapy device will not be left with the patient until clarification to the questions at hand can be resolved. Physicians try to give patients every opportunity to heal properly, and OrthoFix bone growth therapy devices are chosen for certain patients because they give them a greater chance for successful healing. As the market share leader in bone growth therapy, OrthoFix is committed to redefining the recovery experience through patient education.